Poddin My Noggin, hosted by CK Sims, creating a platform to elevate, educate, and heal by creating a space where people can share their stories of struggle, triumph, and redemption. CKS Media.
Hello, everyone, and welcome back to another episode of Poddin My Noggin. So I'm your host, CK Sims, as always, never changing. This week, however, we are joined by Dr. Brett Cordis. Now, let me rephrase that. Award-winning doctor and surgeon, Brett Cordis. Welcome to the show.
Thank you for having me. I'm excited to be here.
I'm excited to talk to you. So, for everyone at home, Dr. Brett Cordis is a surgeon and ENT, but he has a really great story. And what I love about this story, and we're going to get into it in a moment, is I had a nurse on not too long ago, and we dove into the fact that as people, we often, come into contact with medical professionals, and we're in usually our worst kind of life when we come to see you, typically, right? I think we tend to forget, though, often, and I'm guilty of this at one point in my life, that doctors are human, and that they have lives and things and stress and all of these components going on behind the scenes that we just don't think about. So when you get a grouchy doctor, or when you get a grouchy nurse, or you get someone who seems, a little detached, while I know you're in need, we always have to remember the person that's in front of us is, in fact, just that, a person. So, Brett, this is why I'm excited about this story. So, I want to go back. Tell us about Brett's just younger years, like in high school. Who was that guy?
Okay, yeah. We'll rewind it a little bit. So I grew up in Baton Rouge, Louisiana, South Louisiana. My dad is from California. My mom is from Alexandria, which is a small town in central Louisiana. And they were both academicians. My dad was a professor of mathematics at LSU, Louisiana State University. My mom was an English instructor at LSU. Okay. And my sister was an attorney in New York City. And she is 10 years older than me. So by the time I was 8 years old, I was essentially an only child. My sister graduated high school, went out of state for college, stayed out of state, never to return. So from a very young age, I felt like the expectations for me were very, very high, which I think it's important, and I want to kind of stress that my parents never told me or pressured me, hey, you have to get all A's, or hey, you have to, win this race or be the best player on this team. They never told me that, but they modeled that behavior for me. So, my dad, first of all, he's 6'9", so he's physically imposing. He played college basketball at Stanford. He's a great bowler. He's a great chess player. He's a world-class bridge player. And so every time I saw my parents do something, it was always at the highest level. So as far back as I could remember, something wasn't worth doing unless I could be the best or do the best at it. That was just written into my DNA almost.
Imposed, like a self-imposed sort of... I'm just imagining all of this sort of implications that would have on a child, right? Whether they did that on purpose or not, the things that you would have told yourself, right?
Absolutely, yeah. And I would get heaps and heaps of praise if I got an A on a test, or if I, scored 20 points in a basketball game. And so I became almost dependent on this praise that I would get, or what I saw as love. So even though it wasn't the case, I felt like I was dealing with conditional love from my parents. And the condition was that I performed or was the best or did the best. So I dug myself a hole, so to speak. And this will come into play later when we start talking about my addiction and whatnot. But that was written into my DNA at a young age. But I was a good student. I was a pretty good athlete as well. Fairly normal childhood. Again, kind of functionally an only child because my sister was out of the house and out of the state by the time I was 8. Went to a Catholic high school. Went to LSU after graduating high school. And I had absolutely no idea whatsoever what I wanted to do with my life. I mean, there were no medical professionals, no doctors, no nurses, no physical therapists, no medical professionals in our family. It was all academicians, and we did have a fair amount of attorneys, but I knew I did not want to be a lawyer. Let me put it that way. But my mom did say, I will say, my mom always used to say that she thought I'd be a good doctor because I had a good smile. So for what that is worth. But in the tail end of my freshman year, while I was studying for final exams, so I was 19 at the time, I developed non-Hodgkin's lymphoma, which is a cancer of the lymph nodes.
Yeah.
And ultimately, that disease was treated with chemotherapy and radiation. It recurred. I was treated with more chemotherapy and radiation. And ultimately, that treatment culminated in a stem cell transplant at MD Anderson in Houston. And that ordeal, that battle with cancer took 16 months. But a silver lining that actually there were several silver linings that came out of that. But one of them is that it made me want to go to medical school and become a doctor. So that's where my motivation to become a physician came from. Because without it, I really had no idea what I was going to do with my life. So went to medical school at LSU in New Orleans. Again, I'm carrying this do the best, be the best attitude with me throughout college and into medical school, through medical school. Graduated at the top of my class into ENT, ear, nose, and throat surgery at Baylor in Houston.
So I want to pause you real quick because there's 2 questions that just came to my mind. So I'm going to ask them now, so if maybe you have a better memory than I do, because I have goldfish minds and will forget what I want to ask. One, the move to ENT, right? I want to ask that. But the first one I wanted to ask is, so the cancer happened at 19?
Yep, 19.
Okay, and it lasted, you said 16 months?
Correct.
And you've been in remission since?
Yes.
That's just bonkers. Like like what's bonkers to me is like, okay, so I'm processing information as you're telling me, right? So I'm thinking to myself, I'm like, okay, you already have this unrealistic expectation that you have to be the best at absolutely everything, and then so you're doing this. You developed cancer. You were treated, and you're in remission. You have silver linings from it, but like, what did you feel in the moment when you were diagnosed with this? Like what? Because that's weight, right? Like it changed your life essentially because you then decided you wanted to be in medical school. But like in the moment of 19, 20-year-old Brett to have this cancer, like, do you remember what went through your mind at that time?
Yeah. Yes, in fact, and so I had 2 cracks at it. I was treated with 4 months of chemotherapy and then another 8 weeks of radiation. And my initial thought when I was diagnosed with cancer was that disappointment that I wasn't going to be able to go on my senior trip. Actually, it was my girlfriend's senior trip, high school trip to Cancun. I literally considered this cancer a little more than an annoyance and an inconvenience. Okay, I'm 19 years old. I'm like in the prime shape of my life. Got, some good things going, making good grades. I have my whole life in front of me, and I think I'm completely invincible. So I was disappointed I couldn't go on a senior trip to Cancun, and I was disappointed I couldn't drink beer that summer. And, maybe I was in complete denial, 100% denial that I had this potentially deadly disease. But when it recurred halfway through radiation, that was a completely different story because the first way through, I think they quoted me maybe like an 84% survival rate. The second time through, it was only 60, and that really got my attention. And so I felt completely powerless and helpless over my life. And it was scary. It was very scary. The second time through, because I was powerless because I couldn't help the situation. You know, if the chemotherapy is going to work or it's not going to work, the bone marrow transplant is going to work or it's not going to work. There's really nothing I can do personally other than have a good attitude. But from a statistical, scientific doctor standpoint, I'm just along for the ride. And so it was a very helpless, powerless time in my life, which is interesting because ultimately those two triggers, powerlessness and helplessness, became my triggers to use drugs later in life.
And for people at home, you had mentioned that you went through stem cell treatment, correct? And I don't know if people know exactly the extent and severity of what stem cell treatment is.
Especially in 1997.
Wow, that's another big one. Do you want to explain it to people at home? Just give like a high level understanding of what it is they do during the stem cell?
Sure. So stem cell transplant basically is needed because they give you so much chemotherapy that the chemotherapy kills every cell in your body. And so in order to survive the chemotherapy, they remove your stem cells prior to the chemotherapy, and they harvest those stem cells and incubate them in some immunomodulators. You're given the chemotherapy, all the cells basically die in your body, and then they're given back to you. Your own stem cells are given back to you, and from those stem cells, all the cells in your body regenerate. So you're able to kill the cancer cells also because you're killing all the cells and then replacing them. And so in terms of what it feels like, it's hard to explain, but basically it's a little bit like giving blood. It's a little more extensive, but they hook up some apparatus to you and they suck blood and stem cells out of one half of your body and they put them in the other half. So it's not a surgery per se, it's a procedure, but it's not fun, I will say that.
And then the post implications, right? Because you lose a lot of your antibodies during that process and become even more susceptible to just regular, normal bacteria and germs.
Right, especially in the first several months. I mean, you're like a newborn baby. Well, you're like a newborn baby without an immune system. So I was isolated in the hospital for 6 weeks after the transplant. It takes, a few months for the stem cells to take, if they take at all. And yeah, I mean, for a long time, you're immunocompromised. And so I had to, for a couple of years, I had to live my life in that reality. Stay away from sick people, wear a mask, wash my hands. It was on my mind 24/7 for a few years. I'll say that.
It was a fear, right?
Yeah.
A very relevant fear and real fear that for someone at 20 years old, if you will, 21 years old at that point, I think we're somewhere in that range, 19 to 21, to have to go through, just period. It sucks for anybody, but like still, I'm just processing this information. You luckily and gratefully, it worked.
Right.
The chemo and the radiation, the stem, all worked. And you have now been cancer-free for, let's just say, I don't know how old you are, so I'm going to say 20 years.
Okay.
I might be wrong, but let's just say that. Is that correct?
Yeah, I've been cancer-free for 28 years, but yes, I'm 48. So,
okay. I thought you were younger.
Yeah. And to give you an idea of how experimental this was, the cohort, we had a 10-patient cohort, and only 2 of us survived. So,
wow.
These days, stem cell treatment is almost mainstream, but in 1997, it was a clinical trial at one of the premier cancer hospitals in the world. So it was definitely experimental at that time. And so I was and remain extremely grateful to, even be here.
Well, we're happy that you're here and that you survived. Clearly were influenced and decided to go into medicine. You went into medicine, as you said. Now, my second question, I did remember. So, like, Goldfish is doing well today. So, you're in med school to become a doctor. What was the choice to go into ENT?
Yeah, that's a good question. So the first half of med school, I thought I wanted to be emergency room physician. ER was a huge show at the time, and that's what I thought I wanted to be. So all my research and all my extra time was spent doing ER stuff. But my first rotation of my clinicals, third year, was surgery, and it was obvious by the third day that I was kind of born to be a surgeon. And the reason I knew that is because my personality matched with the personality of the surgical residents. And so that's one way that med students figure out what specialty they end up going into, is because you kind of find your people, so to speak, depending on what specialty you're rotating through. But I did have the forethought, probably because of my cancer experience, that I didn't want to spend, 80 or 90 hours a week of my life working. I had this second shot at life, so I wanted to enjoy it and or better the lives of others. And I didn't want to do that exclusively through working all the time. So I didn't want to be a general surgeon. And so ear, nose, and throat surgery is a surgical subspecialty. So you don't operate as much as a general surgeon. You're in the office like an office doctor most of the time. It's essentially an 8:30 to 5 job. You're not working like many physicians are. So that was a combination of two reasons that I chose ENT.
I like that. It was very intentional. And then you went on to become this wonderful ENT surgeon, which you did this, I believe, if I'm not wrong, 18 years?
I did it 16 years. Yeah.
16 years. So now comes the hard question. What was your first experience, besides obviously the cancer, and was the cancer time your first experience with using opioids?
Yes, and this is key, because I used opioids, which are painkillers for listeners that may or may not know, a few times during my cancer battle. Now, lymphoma is generally not a painful cancer. It wasn't a painful cancer for me, but I did undergo several biopsies and procedures that were. At the time, at the age of 19 and 20, when I took an opioid, it felt nice. It felt like a couple of beers. It felt like a nice buzz, but it wasn't earth-shattering. It wasn't anything to write home about. And it certainly wasn't the situation where I was looking forward to take another pill. I didn't finish the bottles, even the prescriptions. As soon as the pain was relieved, that was it. I didn't need to take painkillers anymore. And so that was my initial introduction to opioids. Now, fast forward, when I got into my addiction, when I took opioids, it was a completely different experience. It was the full-blown, absolutely euphoric feeling that I had never felt before in my entire life. Same exact medication, same exact drug, but a wildly different result because of where I was in life during those two events.
Now, are you comfortable sharing the trigger or the moment that you experienced that, or how you came to experience that euphoria with?
Sure. Yeah. So medical school is 4 years, residency is 5 years. So it's 2009 at this point. I graduate residency. I'm a full-blown ENT physician and surgeon. I join a group inside the Texas Medical Center across the street from MD Anderson, ironically enough, which is where I had my stem cell transplant several years prior to this. And I was a very, very successful and good physician and surgeon. I built my practice up within about 14 months. I was already at 100% capacity, seeing 100 patients a week, doing a day and a half of surgery a week, which is a lot for an ear, nose, and throat doctor. And so I was, very successful pretty quickly. And so around year 5 or 6, at the time, I started to feel boredom. Now, in retrospect, what I was feeling was a lack of fulfillment. But at the time, I felt bored. I felt unstimulated. And that grew into an anxiety in me, which was extremely uncomfortable. At the same time, my kids are coming into their teenage years. So I'm dealing with normal teenagers, but I'm used to being able to control everything in my life. I'm used to being able to control outcomes that I'm involved with. You can do that when your life is testing in a classroom, right? Parenting doesn't work that way. So for the first time, I was experiencing life where I wasn't wildly successful. I wasn't the best parent on the block. And I didn't know how to cope with that because I'd never been in that situation before. And so I was burning out a little bit at work, and I was getting this helplessness and powerless feeling and sensation and lack of fulfillment at work and at home because I just didn't have the tools to be able to function when normal life is going around. And it was very new to me. So one day it was a Friday afternoon, my general pattern on Fridays would be to come home. My wife and I would sit out by the pool. I'd crack open a couple of Bud Light Lime beers and we'd drink and talk about the week, and it was great. So this one Friday afternoon, a drug rep dropped by some hydrocodone-based cough medicine samples. And I had the bright idea that, you know what, let me just I remember liking that hydrocodone when I was a cancer patient. That kind of felt good. So I wonder what this would feel like. So instead of the 2 Bud Light Limes that Friday afternoon, I took this cough medicine sample. And because I had these negative emotions that I was trying to avoid, and I had this deep emotional void, when I took the medication, the euphoria was indescribable. And unfortunately, that one decision led to a 6-year, progressively severe, full-blown addiction to painkillers that did not end well,
So, I mean, you started off with trying the sample, but so at what point then, and I'm just being mindful of the time, at what point then that did you say, I want to repeat that quickly?
Yeah.
Like, was it quick?
Yeah, so I took one sample on Friday afternoon, and then I think the following Monday, and it was very, 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 very slow. I was using once a week, twice a week, 3 times a week, 4 times a week. I wasn't using every day for about a year and a half. It was that slow of a progression. And then I was using multiple times a day. And then I was needing my patients' pain medications that they were throwing away, I would go in the trash and take because cough medicine samples weren't doing it anymore. And so I was, as any addict can attest to, once I was a daily user, I was using just to not have withdrawal symptoms. I wasn't really feeling this euphoric high anymore. I just had to use so I didn't feel terrible. And if you have not experienced that, it's a blessing that you haven't, because it is not a life that anyone would choose.
Yeah, it's so interesting too, because you said it was like a year and a half before you started using daily, and I'm thinking in my brain that, when you took the first time and you went back and you took that second one, what levels of justification you gave yourself, right? And then how it snowballed to becoming a daily thing, how we lose control. I have not had any opioid addictions or any of those things, but I have taken them once in a blue moon for non-pain reasons, just boredom, right? And I understand why we have an opioid crisis in our world. because, and I understand the feeling of what the opioid does for you in that moment. It's almost like, and I'm not romanticizing, but also I don't think we should be afraid of talking about it either, is for me, when I took it, it was almost like feelings and pain just gone. And it was like this sort of like lofty little weightlessness that you experienced that was really quite lovely. And I recognized immediately how dangerous that drug would be for me.
Mm-hmm.
Because I have used many drugs in my lifetime. In my 20s, I was a wild one. But yeah, so I understand that, but I don't understand the addiction part. Only my relation is cigarettes. I'm a smoker. I've been smoking since I was like 12 years old. I understand the addiction in that sense, and I often try to use that to think like how, like when I go like 4 or 5 hours, or I have to get on a plane where you can't smoke, and like the panic and the it's not the same, but like I understand that what the addiction does. Your body wants it, your mind wants it, all of those things. We're going to take a quick break. We'll be right back.
Partner today with CK Sims and Poddin My Noggin to get in front of an audience that cares. You will be supporting mental health stories, tales of resilience, and uplifting content, aligning your brand with bringing goodness, authenticity, and kindness front and center. This spot could be yours. Do you have a story of struggle and resilience? One that you want to share with others and possibly help someone through their own struggles? Find the link in the show description and fill out the guest form today.
Welcome back, everybody. Before the break, we have been talking to Dr. Brett Cordis about his life from childhood all the way up until not so long ago, I don't believe. But we sort of talked about how, well, we didn't sort of talk, we talked about it, sorry. And I'm distracted now because I know that my best friend's going to give me crap because I'm fuzzy. And I'm not a technical person, so I'm trying to like make myself unfuzzy. Anyway, we were talking about how you started using opioids and how it took you a year and a half to become a daily user. And you had mentioned that, you know, it got to the point even when you were going through like your trash of your clients who were throwing out their medicine to get that fix. Where and what was because you had mentioned to me that this obviously almost completely derailed your life and career. What was the moment? What was that defining moment where I guess you got caught or you realized you were in over your head?
Yeah. Well, that's a good question, and the answer is different. I realized that I was in over my head around year 3 when I was using every day, and I'm telling you, I have an incredibly strong willpower. And it was no match whatsoever for this addiction. I could not wean myself off of this stuff to save my life. And I couldn't do it. And I tried multiple times. So somewhere around year 3, maybe 3.5 or 4, I realized I was in trouble and I was not going to be able to get off this drug by myself. But at the same time, and this is how sick my brain became, I truly thought logically that I could use these opiate medications every day for the rest of my life and be a great doctor and a great husband and a great father. I really truly believed that. That's how distorted and sick my brain got. You mentioned justification. I mean, the mental gymnastics that I would perform to justify using drugs and then going to operate, it's mind-boggling. You know, I don't even remember what I used to tell myself. I know that I convinced myself that I was a better doctor, I was a better surgeon, I was a better husband, I was a better parent when I was on these medications because it was like a permanent good mood, you know. But I got caught when a patient suspected that I had stolen his, and the ironic thing is that I had not stolen his pain medication, but it was enough to get people poking around and looking around. And my partners found out, and they terminated me almost immediately. And so they sent a letter out to all my patients saying, due to medical reasons, Dr. Cordes is no longer with the group. Meanwhile, I'm a Little League baseball coach. I'm a YMCA basketball coach. We live in a suburb of Houston that's pretty small. And so, you know, word like that spreads pretty quickly. And so my personal reputation suffered. The reputation of my family suffered. My professional life was completely cut off because I was terminated from my job. This all happened quickly.
Now, did the truth of the story get out, or just that you were released from your position at that time?
Yeah. So anyone who was near the suburb that I lived knew the truth, but patients elsewhere, you know, if you picture getting a letter that one of your doctors is no longer available, you don't really go poking around any further than that.
No.
But yeah, the state medical board got involved, and so it was published online, the truth. So anyone who Googled me at that time would be greeted with that information, which was frustrating, and for me felt unnecessary, but needless to say, that's what happened.
Well, people like to do this for some reason, right? To label you something. And it doesn't matter, you know, how good at something you might have been. It's whatever it is now, typically is what they fixate on. So you might have been a great doctor, great husband, great father, great coach, all of those things, but now you're the druggie, right? You got terminated from his job. And I hate that about humanity, because people don't look through the lens of kindness. So if they're approaching you and you got terminated because you were using narcotics or opioids, why was he using opioids? Does he need help? Like, these are the things that come from my mind first, right? But I know that this is not a normal thought process for most humans. It's like, oh gosh, he's one of those. Can't believe he'd do this. Like, all of this negative connotation. So what you had mentioned something, and I want to make sure that we move on to what you're doing now. But you had mentioned something. You said that you had tried several times to wean yourself off of this medication. What's interesting about that is this ties back into the theme of the powerlessness and helplessness. And I wonder how much that played a role during your actual addiction, right? So you would have experienced that if you tried to disengage from opioids but were unsuccessful. Would those feelings not have shown up?
Absolutely. Yeah. In spades.
Yeah. That's heavy. So you got caught, you were terminated. There's so many layers to something like that as well, right? Like, it's not just it just affects your kids, it affects your wife. And this is not trying to lay guilt or anything on you. I just want to be clear about how this impacts sort of everybody. What was the next step for you?
So I ended up going to rehab for 3 months. I got terminated in 2019, and I went to rehab in 2020, right after COVID hit. So I was in rehab for 3 months during those first few months of COVID. And, you know, it's interesting because addiction is a disease that is equally, if not more, dangerous than cancer is. And the experience of being treated for cancer and being treated for addiction is so different because you're treated differently, and you don't get the same levels of support from either random strangers or even from family members. And it made me appreciate how valuable that support was the first go around with my experience with cancer, because it was not there with addiction. And that's
because there's stigma and ignorance, right, with addiction. And okay, so people I can hear all, like, if you know, we were in the bowels of social media, how people would try to justify their points. Well, he took that first, you know, that first medication. He made a choice. He did it. He did this. And we're so quick to try and just push something aside as like, well, he made a choice. Yes, he made a choice. But when he took that, and I'm saying this, this is me defending you or any other addict. I don't believe that when you took that first one or that second one or your third, fourth, fifth, sixth, seventh, or eighth, you ever intended to become an addict and to potentially disrupt your entire life, to lose your license or be terminated or to be exposed in such a public way. Like these things, this is not how it comes to be. You took those pills because you needed to sort of numb the suffering that you were experiencing in that moment, and people don't look at it like that, and it angers me because yes, if you had if the notice that went out to your patients was what got out and it was because you had cancer, you were terminated from your role, the whole community would rally behind you because that's a sickness they're familiar with and that's promoted and talked about regularly. And they have marches and fundraisers and all of those things. But addiction, that's that dirty little thing that nobody wants to talk about or be anywhere near. But it's not. It's still a disease, and it still needs this treatment. It still needs support. You need all of that to rise above, and people can be treated and saved from addiction. But that's me giving you a sermon that you know all about. But like, it's just that Anyway, so you go through rehab for 3 months during the pandemic. Were you successful the first time?
Yes. Rehab was a phenomenal experience for me. First of all, I was willing to admit that I needed help. And so I didn't waste any time in rehab. I mean, while driving to the rehab facility, and this is something I'm extremely grateful for, because with the ego that I had at the time, this was my higher power at work. For me to become willing to admit that I needed help and that I knew nothing about addiction and that I was going to have to rely on these other professionals, completely rely on them to get me better and to trust them to do so. It's really a small miracle that I was able to get in that mindset at the outset of treatment. So that was a blessing.
I wonder if it's because you were in that almost identical sort of situation, not the external parts, right? But because you needed to be so reliant. You had mentioned that you were just a person on a ride during cancer. It was everyone else that was trying to get you better, to do those things. You were showing up and taking this treatment. I wonder if it was that experience that allowed you to pivot so quickly because it was something familiar.
That is a great perspective. I have not thought of that, but yes, absolutely. I think that's a good possibility. Yeah.
And you're a winner, right? I'm saying this because this is what you've identified throughout this conversation, is that you're someone who wants to win, wants to do a good job. So you were faced with a situation and you had to go to rehab to fix things, right? That's step one, to get better from addiction. You're not going to go and do it half-assed.
Right.
Like, you've already identified this like several times throughout this conversation. So yeah, I don't know if it was a miracle. I think that was just you, Brett. That's what I'm hearing, is that was you up for the challenge to go and seize it and make the most out of it. So you went 3 months, and then did you have a relapse ever?
I did have a relapse. I never relapsed on opiates or alcohol. What I relapsed on was kratom, which is an over-the-counter legal kind of herb that has opiate-like effects. But what happened was I when I went back to work, I was being monitored with drug testing, and that substance showed up on a drug test. And so I relapsed and then had to go back to rehab 3.5 years later. Although I had already completely taken myself off of that supplement. So I was not a functioning addict, meaning I wasn't using it at all when I actually physically went to rehab. But I do consider that a relapse. And so I've been sober and clean since that, which was 2 years ago. And I've been sober and clean of every other drug, and especially opiates, for over 5 years now.
Yes, I see that you're in your 5th year of recovery. And you said you went back to work. Were you back to work as a doctor?
Yes, I was out of work for 4 years,
Okay.
which was just brutal for my mental health. I mean, again, powerlessness and helplessness and lack of fulfillment times 100 being out of work. You know, I'm kind of like a border collie. I have got to have a job to perform and to do and scamper around and be busy. And without that, I just feel like I'm wasting life away. Probably that's a little bit of survivor's guilt from the cancer, because I always feel like I have to constantly be bettering the lives of others to justify the fact that I survived my cancer. But I don't do well when I don't have tasks to perform. So that was pretty rough. And so I went back to work, yes, as an ENT physician and surgeon in 2023. But I just liked it this time. I didn't love it like I used to. I had lost the passion that I had always had for clinical medicine, ever since I was diagnosed with cancer, really, almost. And so it really kind of worked out. It's funny how fate knows what it's doing sometimes, because my 1 year contract was not renewed with this practice because it was purchased by a private equity group, and they had other ideas. And so I found myself in a position where I could either get another job as an ENT or completely pivot career-wise and find something else to do. And so around that time, I became aware of life coaching and what it meant to be a coach. And coupled with the treatment and the counseling that I received during rehab, which is cognitive behavioral psychotherapy, that's what coaching is based on. At least most coaching techniques are based on. And so it was a lot of the same language. It was a lot of the same. It was very familiar to me. And so I'm finishing up my training, my formal training and certification training for life coaching. But now I'm a physician coach for other doctors who are experiencing symptoms of burnout, which may or may not include substance abuse.
So I think that's fascinating, because I went to your website yesterday, and I'm going to need a new webcam because I'm all fuzzy today. I apologize. But I hear my best friend being like, what the heck? Why? But anyway, so I went yesterday and I looked at your website, and you had a video on there. What's the difference between coaching and counseling? And I watched it, and I was like, what you were describing, friend, in coaching is CBT. You didn't call it that in the video, but I was like, I'm like, which is a form of therapy, but it's got so many applications. And CBT changed my life. So I'm only here today because of CBT. I'm only here today because of cognitive restructuring, for one. And what you talk about in your coaching is beautiful, because at 35, and I'll share this with you quickly, but at 35, I had a major life event. And by major life event, I tried to take my life. I failed. So I'm very grateful that I failed. Now, I wasn't then. And, you know, just through the jigs and the reels, I had been through therapy. I had everything. However, it was my internal dialogue that was my problem since childhood. Faulty assumptions, as you had mentioned in your video, and it took a great deal of CBT and cognitive restructuring specifically to completely change who I was as a human being.
Hmm.
And I went from being sort of a miserable, awful, self-loathing cluster thief of a dumpster fire to becoming someone who leads with kindness, who loves life, who can't believe he gets to do this, to have conversations with inspiring people, um, who just wakes up every day with a heart full of gratitude to get the opportunity to live and to experience life and to have just just share my zest for kindness and love with other people. So like what your video indicated on the burnout.com was, it resonated with me, and I'm like, I love that you're doing that. So you went and you did your coaching certification, I believe I read, correct?
Correct.
And
Yeah.
so now you are helping. Now I like that you niche down, absolutely, because I think what a, what a really great service for medical professionals. I know it's for physicians, but like what a great service for professionals, physicians, because we talked about this at the very start of the show, how physicians are humans,
Mm-hmm.
and they have home lives, family lives, financial struggles. Things happen just like any other human being in the entire world. Yet they're tasked with going into the workforce to care for other human beings. That's their sole job, right? Is to show up and treat ailments and illness and health of other people. So, was your desire to focus on physicians the fact that you felt there wasn't support for you during your burnout phases as a physician?
My, I would have to say that my primary motivation to niche down to physicians is just because it's needed. The burnout rate for physicians is 60%, almost 60% across the board. And it is very difficult for physicians to get help for mental health challenges because they're afraid of the board finding out and challenging their ability to safely practice medicine. They're afraid that their patients are going to find out, which are very real concerns. And so, and then on top of that, doctors aren't the most emotionally vulnerable people out there, and they're not the people that are most likely to ask for help. And so it's like a lose, lose, lose. So it was really the need that I felt that I was filling, as opposed to the lack of opportunity for myself previously.
Well, I think that's, I mean, who better? Like how, and I'm talking this out real quick because I'm very cognizant of time, but who better if you want to look at this situation through a scientific lens to coach physicians on burnout and just living a better life, essentially, leaning into themselves, listening, understanding what it is they need, helping them get out of ruts, restructure whatever. Who better to do that than an actual physician who's gone through having their license or termination? I'm not sure if your license was revoked. I know that you probably fought very hard to get back into the workforce in that 4 years. Who better to do that work? Like you offer something. You niche down, but you offer something to that niche that is would probably be very, very, very difficult to find, right? Someone who truly understands all of those nuances, all of the facts that if it gets out to the board that they're struggling with burnout or they're struggling with mental health or they're depressed or any of those particular things, clients, the hospitals, the clinics, all like it's so extra for a doctor, right?
Yes, you're
the
correct.
the risk is so extra to show any sort of weakness because it's perceived as an incapacity to do their job. when it's not actually correct, because I'm sure that we have a lot of doctors, if not all, who are going to work doing their best while struggling with some sort of something going on in their lives. Because once again, we come back to that very core piece. Doctors are human.
Mm-hmm.
Just because they have medical degrees and they make big dollars does not mean that they don't experience life like everybody else. And the other the other part of that is that how much time they've had to spend in school and learning just to get where they are. Like, it's not, you know what I mean? Like,
Yeah.
so you're doing, the website for everybody at home is theburnoutdoc.com. Are you doing nationwide throughout the US life coaching, or globally, or is it more, restricted to, I'm not sure if you're still in Louisiana. No, you're in Houston.
I'm in Louisiana now.
Oh, you're in Louisiana now.
Yeah.
Okay.
I mean, it's global. So, and yes, I'm treating only physicians. I have not had the opportunity to treat non-physicians. That being said, I don't see myself turning someone away. Any healthcare provider that's burned out that approaches and signs up for a consultation who isn't a physician, I don't see myself turning anybody away who's burned out. So I would say physicians plus I would treat, and it's global. It's wherever the internet reaches.
Which is everywhere.
Right, because it's all done via Zoom. So I'll be in your living room if you allow me to be.
Well, and I think that what's interesting, I think that what's evident is that you are smart and you're personable, right? You have lived experience. You have expressed that this is your calling. You've shown that you've wanted to help people throughout your life through this conversation. So, yeah, it makes sense. It makes sense to me. And so if you're out there, whether you are in Botswana or Calgary, Alberta, or Houston, Texas, or wherever you are in the world, if you are a physician or, say, a healthcare provider, or someone who's in a position where they don't feel that they have the opportunity to show weakness or show vulnerability because this could impact their lives in such a negative way, go to the burnoutdoc.com and get hooked up with Brett Cordis. Not Cords, like I thought it was before I heard you pronounce your name. Cordis. So as you're continuing to do this, I would imagine that now, 5 years into recovery, life has turned to some new normal for you.
And it has. Yeah. It's wonderful. I consider myself now having a third go with this life, with cancer being the first two and addiction being the third. So, yes, life is good, one day at a time.
And your teenagers now we just lost your video feed, but came back. Your teenagers are now probably young adults?
Yes, 20 and 18 are my kids' ages.
That's so the young adults.
There you go.
They're at that leave the nest phase, and go experience life. So you're doing this. Do you have something else? Is there anything, like, do you have any other goals? You seem like a goal-oriented person, Mr. Cordis. Also, I have another question before we continue. Are you still Dr. Brett Cordis?
Yes.
And you still retain, like, I don't know how this all works, but, like, you still retain, like, your doctorship?
Right. Yeah. Yes, I'm just not my license. I've allowed my licenses to lapse in Texas and Louisiana, so I'm not a licensed physician, but I am certainly a physician.
Okay, so that's what I wanted to know. So yeah, so you're no longer licensed to practice medicine. However, you are still very much a physician and a doctor, which is very cool. And I love, I'm sure that there's people that might listen to this show or see a snippet on social media and think, like, who would walk away from, a job? Because some people don't understand it. being a doctor, a surgeon, to life coaching, right? But if you listen to the whole podcast, go check out theburnoutdoc.com. You'll understand why you've made this choice. Do you have any other goals currently?
Yeah, in fact, I'm just now, like within the week, and talking with another life coach who I'm going to partner with, who I actually trained in residency with. And we've started to go and approach other residency training programs to offer our service to the resident physicians who are training.
I love this idea. I think that I love that idea actually, because residents go through it.
Oh yeah,
they really go through it, right? And they don't usually make very much to go through it. So there's not even that sort of balance in that when you're a resident. That sounds fantastic. I love this. So you are on social media?
I am the Burnout Doc on LinkedIn and Instagram and Facebook. Yep.
Perfect. So everyone at home, get out there, follow the Burnout Doc. If you're a physician or in healthcare, or like I said, in another like high risk type position, and you need some help reorganizing life and getting yourself realigned with your purpose, reach out to Dr. Brett Portis, and he can set up some Zoom calls for you to work through that, applying a lot of CBT techniques, which is just for people at home. Did you know that it is the only empirically proven counseling technique in the world?
I didn't know that.
Yeah, CBT. It's empirically proven.
Huh.
All right. So thank you very much for being a guest on the show. I've really thoroughly enjoyed this conversation. I love the work that you're doing, and I loved your vulnerability. And for everyone at home, until next time, get out there and live your wildest dreams.
For media and sponsorship inquiries, email info@ccsims.com or visit ccsims.com and fill out the contact form. Be sure to subscribe so you don't miss an episode. A new episode airs every Saturday. CKS Media.